When someone comes to us with a problem, we don't even listen to the problem fully. Why don't you do this is our reaction to someone who comes to them.
Listen to listen, not listen to speak.
Exactly.
What's happening, everybody? Thank you so much for coming to my YouTube channel and to the podcast. I really appreciate that you're here. This is There's More to Us, the podcast. This has been a life project. It really has been. We've been working towards it all along, and now we finally are here and we're rolling out episode 1. And I'm truly happy and very excited for it. There's More to Us essentially is a podcast about life, but with a backdrop of mental health. We have professionals from various walks of life coming in, talking about their decisions, their thoughts, their patterns, and everything that they've done in their life with a backdrop of mental health. This is a place that you can come to, which will be a safe place. It will be a place of learning. It will be a place of reflection, and hopefully it will help us put one foot in front of the other and lead our lives in the best possible way. So episode 1, we've got Dr. Abhijit Nadkarni joining us, somebody who's done tremendous amount of work in the addictions and substance use space. And especially because substance use and abuse has been in the news lately, of course, and we want to get an objective view of that and talk about the issue at large with alcohol and substances and behavioral addictions as well, including social media. So we covered a lot, and here we are with episode 1. Let's get going. Thank you so much for doing this. Always gracious with your time.
I'm honored that I'm the first guest on your podcast.
But this is not new. You've always been very gracious. Even when I only had a phone to shoot with and I barged into your office saying I want to film a video for social, you said, okay, fine, you put 40 minutes aside for me.
You're embarrassing me now, Sumedh. You're embarrassing me. Always a pleasure to help.
This is the first time we're meeting in the pandemic age. How have you been? How's these last couple of years been for you personally, professionally?
All good. Considering the circumstances, I would say. Obviously, life has changed.
Yeah.
It's to an extent that it's become a cliche now to say that life has changed. And then certain words like unprecedented circumstances have all become a cliche.
Yeah.
But I guess if you look at it as a learning experience, learned a lot about how people respond to adversities.
Yeah.
Sometimes in a good way, sometimes in not so good way. So I think, a lot to learn.
So what's that like? Tell me more. How's that been like now? Is there a correlation between the pandemic and behavioral patterns in addiction and substance abuse? Have you seen that in your work?
Yes. That would be expected. Generally, behavioral patterns do change in times of stress, and this is in a sense has been a universal stress manifested in different ways for different people. For example, drinking patterns. It's early days yet in terms of, this is anecdotal, it's early days in terms of evidence, like hard research evidence to suggest that, but there's if you look at some, for me the interesting bits are some of the hard indicators. So let's not look at people, but let's look at what has changed in our environment. If you look at where you are at right now, this place here, and you look at a kilometer radius or a 2 kilometer radius from here, what are the two things that in terms of stores, shops that have increased in the past 1 year?
Bars and pharmacies.
Pharmacies, chemists, absolutely, and not bars,
so
fancy alcohol stores.
Wine stores.
Fancy alcohol stores, not just these hole in the wall wine shops, right? Like proper supermarkets of alcohol.
Yeah.
I can count at least 8 or 9 in this 2 kilometer radius.
That's true.
Which was not the case. Chemists, you can understand.
Yeah.
But alcohol, probably another kind of treatment for people to deal with stress. And it's fascinating. It's fascinating when the reasons for starting drinking or continuing to drink come out. It's very small narratives around I drink for pleasure.
Yeah.
A lot of the conversations, the narratives, the explanatory models, as we call them in technical terms, are around drinking to manage psychosocial stress.
So it's a coping mechanism essentially.
It's a coping
It
mechanism.
numbs the pain.
Absolutely. Coping mechanism for psychological stress, financial stress.
Especially when people were stuck, right? A lot of millennials and Gen Z folks were stuck away from home. So they're almost in that same space, right? Where obviously people that earn set amount of money, their jobs went out of the window, right? They only have X amount of savings, which are very less, or they don't, but they still got to get what they're addicted to.
Whoever kind of gets caught into this trap of substance use disorders, as we call them, there are going to be implications for that individual, for the families, and for society in general, because there are costs to society as well.
Yep.
It's not just the individual that is getting affected.
Big one.
There are costs
Yeah.
to society,
Yeah.
there are costs to health systems, the cost of policing. I mean, there are lots of other costs that come with
Yeah.
it. Basically, I think alcohol is something, and then again, alcohol, and I just want to kind of conflate it a little bit to the larger mental health space. Addictions, mental health, probably one of the very few things which do not discriminate based on
It's very true.
gender, age, color, caste, socioeconomic status.
Yeah.
It can affect anyone.
Access, number one, of course, like you mentioned, alcohol stores, tons of them opening up. But just to take this a little broader, right? Obviously, alcohol is one thing, but people are addicted to a lot of things. There are a lot of things, from things that are available in the pharmacy that kids get addicted to alcohol stores, and you can go to drugs, multiple things, right? So would you reckon access and availability are the two key factors there?
Oh, absolutely. I mean, absolutely. If you look at the policy solutions that work, I mean, not individual level solutions, but policy solutions that work, one of the key things is reducing access, and you reduce access in various different ways, right? One of the strongest evidence for reducing alcohol consumption is increased taxation on alcohol.
Make it tougher to buy it.
It reduces alcohol consumption across the board. I mean, people who already have drinking problems, it doesn't do that.
Correct.
But across the board, at a population level, it reduces alcohol consumption and consequently the public health impacts of it. In cultures where there is permissiveness around drinking alcohol, over time, there are norms that develop around how you can drink, what you can drink, what is acceptable when you drink. So if you look at the Mediterranean culture, right, you kind of start off having your wine at your meal times, little amounts of alcohol, spread over a long period of time over an afternoon, along with your meals. You don't get intoxicated. You kind of don't drink and drive. That's a norm that has developed over time. Whereas in cultures where it's seen as a taboo, such as India, there are kind of moralistic stance that's taken about alcohol. A person living in such a conflicted environment when it comes to understanding of alcohol, what does that person do? The person wants to avoid all of that glare of society on him or her, which means that they have to drink very quickly, right? They go to the wine shop, get the alcohol, pour it, finish it very quickly, go back home to have the meal. Right. Now, that is a recipe for disaster because it's not good for health. Large amounts of alcohol consumed in small amounts of time is not good in the longer term and not for the shorter term as well, because accidents and injuries happen because of that in the shorter term, in the longer term effects to health. But sometimes completely cutting off access to things does make people do other silly things to get access to it, right? So for example, let's say drugs are illegal, right? Illicit. But that does not stop people from accessing them.
And that's a black hole. I mean, why is alcohol allowed and the other drugs are not? That's another thing altogether. It's a different episode.
I wouldn't want to get into that.
And I don't want to.
It's very complex. It's very complex. And one could argue that, let's say, for example, not that I want to appear as if I'm endorsing it because it's too complex. But let's take cannabis for example, and you take alcohol, right? Alcohol causes more deaths than cannabis could.
Now you will get a little popular, just a little bit.
Well, yeah, but I don't want to be seen as endorsing cannabis, right? Because there are other complexities around that, and the debate is not so simple. Because if we just scrape the surface of the debate, you end up coming as someone who is either for or against it, and a lot of things are at play, and they vary based on the substance. And why just substance? I mean, we are kind of moving beyond substances when it comes to addictions. There are behavioral addictions as well, right?
Absolutely.
Gambling and gaming, and internet.
Pornography.
Yeah,
So
pornography.
much.
I mean, all of these are addictions. So, yeah, it's a very complex issue. I think we're just kind of scratching the surface when we talk about these things.
I think we got to bring up social media, right? It has to happen. It is a 21st century phenomenon. Of course, we can. We sit here and it still is not classified in that bracket of addiction, but we're getting there. Tell me, you guys, what's your screen time? Usually, how much time do you use? No. Tell me how much time do you use your phone in a day? Give me a rough number.
5 hours.
4-5 hours. That's conservative. What about you, brother? How many hours?
6,
7. I'll tell you something. So obviously you know this. They did a survey in Colombia, I suppose, a few days ago. The maximum screen time a person had in a day was 9.5 hours. That's literally every waking minute of your day. We're here now. I mean, this is real. I mean, as you're speaking, I have my phone on, obviously for different reasons. I'm not scrolling through Instagram though, let me tell you that. But it's real. It's here. Do you see cases of, are they coming in? Are people coming in and saying, listen, I am or so-and-so person is addicted to their phone or to anything that they do on the screen? And how's that? What are the dynamics of that as compared to other forms of addiction that come to you?
So this is compared to substance addictions. Behavioral addictions of this kind are relatively a newer phenomenon. Your question about do they come to light? Do I see them in my clinical practice? Not much.
Not much.
But there's a caveat to that.
Mm-hmm.
What we see in clinical practice of anything, alcohol addictions, substance addictions, even mental health problems to a certain extent, in the kind of clinical setups that we work in here in India, is just the tip of the iceberg. It's by no means a reflection of what's really happening in the communities.
Wow.
So just because we don't see many of them does not mean this is not
cases
happening within and it's early days yet in India for people to be kind of doing getting kind of to that level where they are seeking clinical help. So educated guess, yes, it should be a problem. Being to restaurants, having a meal, seeing a family of 4 at the next table, all 4 waiting for their food, all 4 on their own mobile phones.
Mm-hmm.
So no reason why it won't be a problem.
Yeah.
Again, same issue as with substances, right? Ease of access.
Yeah.
You have it at your fingertip.
How do we get off our phones? I think everybody here in this room, there are about 5 people here, 4 people. I think we all want to get off our phones, at least a little bit. Look, I mean, the thing is, you've got your phone makers coming up with well-being settings on the phone where you can get notifications away.
But that's the irony, right? You have apps to get you off apps. I mean, I don't really understand the logic of that. My phone. I mean, I hardly use any apps, but my WhatsApp doesn't have any notifications, so I don't even know whether I've got a new message or not.
Oh.
Okay. So that nothing is beeping. I don't see any notification. So I look at it when I want to. I keep it in a different room when I go to sleep at night. It's not with me.
That's a big move. But that's really hard for a lot of people. It's insanely difficult to do that, right?
It is.
Yeah.
It is. But I mean, you can't have it both ways, right? I mean, you can't want to change your life.
But that's where we're at, right? This is, liken this to alcohol, right? You cannot, there are cases where you cannot stay away from the bottle or you cannot stay away from the drug. Now we're in a place where we cannot stay away from the phone. Do you think it's similar? Do you think the lines are blurry now?
See, there are certain principles which cut across all of these addictions, right? You, let's say, if you are dependent on alcohol, which is you can't live without it physically, that if you don't have you had your last drink tonight, you wake up in the morning, you have the shakes. Right? Okay. Same thing will happen with your phone. I mean, if I tell you kind of keep your phone switched off for the next 6 hours, will you be able to do it? No, you'll become restless, you become anxious, right? So the principles of these addictions, be it substance addictions or behavioral addictions, the principles.
So the principles are the same.
Remain the same.
Yeah.
What is problematic is just like alcohol, the ease of access now to devices. They're becoming ubiquitous. Yeah, I mean, smartphones are increasingly. I mean, like the prices are keep going down. Data prices, I think, keep going down. But a lot of it is also around behaviors that start off early. You give an example about children. I mean, I think it's an evolutionary thing. I mean, kids these days are born with this motion in their finger.
Swipe right.
Kids sitting in their prams are able to do this. If you give them a device,
We're being called old now on social when this video goes up.
Well, I was ancient 10 years ago, so I'm not complaining. So
I might have a problem with that.
One of my young colleagues said to me that I'm the oldest person she knows. So,
but you're young and happening for me.
I can
cool.
live with that.
Yeah.
But the thing is that these are learned behaviors, right? I mean, these are no one is born with it. You as you are growing up, you see what's happening around you. You mirror things and you learn from things. So if you let's say a 5-year or a 3-year or a 4-year-old child is sitting with the parents, both of whom are on their own devices and not having a conversation with the child,
you pick that up.
Child kind of just thinks that it's legit. I mean, this is the way to do it. This is how it's supposed to be, and that's what the child will want to do. If the child cries or throws a tantrum at an age where they are supposed to be throwing tantrums, the way to reduce the tantrum is not to kind of ensure that there's kind of behavioral management, but the way to kind of respond to that is take the phone, keep quiet. The child is going
just
to
less
learn
effort.
It's easier to do that.
Yeah.
But it's easier to do that in the short term because it's then the same parents will be complaining. It's like when they get to the 10th standard examinations or the 12th standard examinations where parents will complain, this person is on the laptop,
all the time,
on the internet all the time.
Yeah.
But the problem didn't start when you reached your 10th standard. The problem started when the kid was 3 years old.
But is that even? I don't think that's even fair on the kid because it's a part of just like you said, it's a part of their life. It's something that they've had access to. They're still young. They're in their teens. They don't, they're
teens
going.
I'm not even talking about teens. Teens is kind of then it's
Fine.
difficult. By then it's difficult. By then it's difficult because the behavior is already.
So you're talking about children, like kids.
Yeah.
And what do you do with teens? What do teens do?
Restrict your access. Restrict your access.
That sounds very difficult, but that's the
difficult.
only way to do
nothing
it.
Nothing is easy. Nothing is easy.
Absolutely.
Yeah.
And also because these young folks, they find it increasingly difficult to connect as a human being with other human beings at this point, right? Especially those elder to them, because there's a significant difference in our young folks now, us, the generation that's previous to us, and these folks cannot really connect to them or even us at various points. So the human to human bit, right, reaching out to get help is increasingly tough. At least that's what I've observed.
Yeah, but then the definition of connect or connection is different for them, right? I mean, the being on Insta and connecting with people is still for them that's a connect.
Yeah, it is.
Right. So the definition varies. Just to be mindful of the fact that we don't want to be throwing the baby out with the bathwater. There are advantages to technology, obviously.
Yeah.
There are,
of course.
Just like but just like anything else in this world, anything that's taken to the extreme is not good.
The very interesting thing that I've observed over the internet or I read, the part of the brain that perceives pleasure and pain is the same, right? It's the same. And the lines are very blurry between the two at times. Once you go a little towards the extreme, the lines get very blurry. How does one sort of begin to, after they observe that, okay, this is not working for me, how do they start taking the first steps?
I think the first step is in identifying the problem, right? I mean, unless you realize and accept there is a problem, you can't take the next step, which is seeking help. And I'll just take the example of alcohol because after tobacco, that's the commonest substance of use in India. And some of the principles that I speak about here would kind of apply to other substances as well. So certain things should get the warning bells ringing. So, for example, if you find that you are drinking increasingly more amounts to get the same kind of effect that you're getting before. Let's say you're drinking one bottle of beer and you that was kind of giving you that pleasant high, and after some time you need two and then three. Then you kind of are increasing your consumption, right? So that is one. If you kind of use it as a social or an emotional crutch, in the sense that you feel that if I don't take this, I can't socialize. You feel that I can't deal with my emotions without it, and you're using it to self-medicate for whatever reasons. You're stressed, and then you let's say you're sad, or whatever reasons. People around you express concern about your increased drinking. Okay, not the fact that you're drinking, because in a culture like ours, just the fact that you're drinking, and if someone is concerned about your increased drinking, that should set your alarm bells ringing. If you need to drink the first thing you get up in the morning,
that's not good.
To kind of get your day going, you should be worried. So there are certain warning signs like this, which will tell you that something is wrong. The key point is to kind of understand those warning signs and then say, I need to do something about this, and then take the next step. I think that's the most important bit of it.
Yeah. What about people living alone? People that don't have somebody watching over them, that want somebody watching over them, but they just don't have them. What do they need to do? Because is it tougher for them? I suppose it is a little more difficult for these folks, right? Who are by themselves, have nobody to regulate them.
Absolutely. I mean, any kind of loneliness is going to have an effect on your
That's true.
mental health, your substance use, etc. Alone is not a problem. Loneliness is a problem. And
That's
these are two
difference.
different things.
Very
you
different.
could be alone and not be lonely, and you could be amongst 20 people and still be lonely. The problem
That's
is
true.
loneliness, not being alone. And in that case, you need to seek out people. And if you, I doubt if there'll be anyone who does not have anyone at all. Right? And
You tend to feel that way. You tend to feel like there's nobody in your life, right?
Yeah,
Yeah.
that's a possibility.
That's true. You would like to
that's a
empathize with that.
possibility.
Yeah.
That's a possibility. That's what I'm saying. So you could
Yeah.
have people around you, but you feel that there is no one for me.
Yeah.
And in that case, there's professional help. And when I say professional help, I'm not talking about going right to the tip of the pyramid, like psychiatrist.
Right?
There are a lot of other things that can be done before that,
Yeah,
right?
yeah,
And there
yeah,
are
yeah.
helplines. There are other mental health professionals where you can get this what we call as low intensity interventions, and which for many people those are sufficient.
They do enough.
Yeah.
Yeah.
So being able to kind of take that step and identify someone, and then seek help, I think that's a major step.
Yeah. What can people around, like everyday people, like you, like me, like anybody, do when they spot such behavior? Is it varied basis on the degree of the addiction, or
There are certain humane principles that should apply when you're trying to help anyone. I mean, it's not just addictions or mental health problems, but anyone. I mean, they're trying to help anyone. Sometimes we forget those. We don't forget those because we want to be unkind. Sometimes we forget those in our rush to help. And we mean well, but in wanting to be helpful, we end up being unhelpful. And what do I mean by that? So, for example, many of us are hardwired to offer solutions.
It's very true.
So when someone comes to us with a problem, we don't even listen to the problem fully.
Yeah.
We jump in with a solution.
Just want to say it.
Why don't you do this? Is our reaction to someone who comes to that point.
Listen to listen, not listen to speak.
Exactly. I think, but it's not because you mean harm. You mean well. I mean, you want to help, but it's not very helpful, right? Because what has worked for me might not work for you. We are different people. Our circumstances are different. What we are experiencing might be different, and my solution might not work for you. The other thing that we do is, when this happened to me, this is what I did, and look at me now. So when someone is feeling, let's say, down and out, and the other person is saying, oh yeah, but you'll be fine, I mean, just do this, I mean, I did this and I'll be fine. That's not what that person wants to hear.
Yeah.
Right?
You're almost belittling them, almost.
Yeah, but without knowing it.
Without
of course.
knowing.
I mean,
Of course.
It is, in a sense, you're kind of communicating that it's easy, you're just not able to do it. Now I'll tell you how to do it, and you will be fine. So giving that listening ear, and then kind of active listening, finding out what is it that you want, not what is it that I want to kind of do for you. What is it that you want?
What I want you to be, but what do you want to be?
Exactly.
Yeah.
In trying to be positive about things, we sometimes end up making that person feel worse, right? Just don't worry about it. Everything will be fine. You'll be okay. Just, that doesn't help many times.
Even if I don't know exactly how you feel, I still am going to be in a place where I understand.
So sometimes that does more harm than good, right? Saying, I completely understand where you're coming from, right? Yeah. And in my clinical work, of course, in India, patients don't kind of contradict the doctor. But in the UK, when I've said this sometimes initially, people have come, the clients have said like I don't think you understand where I'm coming from. When I've said I understand what you're going through. Yeah. Which is true. Yeah. Which is true. And so these are certain things that we need to be mindful of. These are things that we which come as a reflex to us without even realizing that we are doing this. Giving gyan, so to say, to people. I think that doesn't work. Sometimes just that listening ear and is very, very, very helpful.
Lots to learn, as always, sitting with you. It's always such a pleasure, and these are obviously such layered conversations, right? There's just so much into it, and every person has their own feelings, their conditions are different, and everybody's outcome is different, the input and output is different. But just to be able to to sort of start, right? A conversation's a good place to start.
Absolutely.
So I'm very thankful for our conversations always.
Yeah, I mean, it's always a great pleasure to have these conversations with you. It also gets me thinking and new thoughts and new ideas.
Oh God, that's an honor. That's really an honor, because you've done some incredible work in your lifetime, and you continue to do. Such a young age, you've achieved so much.
Oh my God! Okay.
And
people would not agree. Young is not something that is associated with me.
But you've done so much already. That's and you continue to do so all over the world, and keep coming back to the show. That's what I'd say.
It'd be a pleasure to come back and talk about other things.
Yeah, we should. All right. Okay, that was episode 1. Lots coming your way. There's more to this, and there's more to us. We'll see you soon next week.